anticoagulation, oral steroids, other classes of diuretics, and calcium and vitamin D3 supplementation.
So management of nephrotic syndrome, again, Kirti, major. Good, be loud.
And then until remission, that is defined as urine protein less trace or nil for 3 consecutive morning samples, and then we place them in the first episode of nephrotic syndrome, and then we place them on alternate therapy of 1.5 milligram per kg for next 6 weeks.
So next, you said for 6 weeks. So when do you term them that the steroids are not working, that is they are steroid resistant? For how long you wait in pediatrics?
Sir, when they not respond for 4 weeks on daily therapy.
Good, 4 weeks, sit down. Now in adults, Abhishek, you want to answer. So what is the regimen for adults?
Sir, in adults,
With what dose you will start, for how long will you give?
say in adults, we can start with 1 mg per kg with a maximum dose of 80 milligram per day. So the response usually in adults is late. It can
Yes.
occur up to 4 to 8 weeks. However, we wait up to 16 weeks to
Yes.
see the complete
To
remission.
term them as steroid resistant.
Resistant, sir.
Look for yes.
And following which we can.
So after patient has achieved remission, okay, maybe 1 month, maybe 4 weeks, maybe 8 weeks. Then
once patient has achieved remission, then we still continue the same regimen for 2 weeks after the regimen, and then we start to taper off the steroids.
And you taper it over how long?
So we taper over. We require at least duration of 6 months, sir. We taper over a period of 6 months.
6 to 9 months.
Yes, sir.
The longer the taper, the lesser are the chances of relapse. And you use the term remission. What is remission?
Sir,
In
remission,
adults.
sir, remission is defined as when the proteinuria has decreased to less than 300 milligram per day, or the spot UPCR has decreased to less than 0.3, less than 300 milligram per gram of creatinine.
Okay. Sit down, sir. Good. So, again, Major Gaurav, pediatrics. So, complete remission. What are your criteria in pediatrics?
When they, for 3 consecutive days, it is negative or trace dipstick.
Okay. Partial?
Sir, when the UPCR is between 0.2 to 2.
Very good. And the serum albumin has almost normalized, more than 3. That is okay. What is steroid dependent?
Sir, when on the initiation of steroid therapy,
then there is relapse within 15 days of stopping steroid, or when you're trying to taper it off. So that is okay. What is steroid resistant? We have discussed when they don't respond within 4 weeks. Okay, in pediatric age group. Sit down. In adults, Hemant, remission he has told.
Yes.
Partial remission again.
Partial remission 0.3 to 3.5.
0.3.
Yes, sir.
Okay, and the serum. Steroid resistant?
Sir, more
16 weeks he has mentioned. Frequent relapser, who are frequent relapsers?
more than 2 episodes in 6 months or more than 4 episodes in
1 year.
yes.
Keep your mic closer so
Yes,
everyone can.
more than 2 episodes in 6 months or more than 4 episodes in
And
1 year.
infrequent when it is lesser.
Yes, sir.
Okay, sit down. What are the side effects of steroid? Any pharmac resident? Mic.
So, steroids causes moon faces, buffalo hump, and it causes Cushingoid features like abdominal obesity, then purple stria on the body, and hypogonadism, and also causes psychosis.
Good. What about
osteoporosis.
Osteoporosis, fracture, avascular necrosis.
Separation of hypothalamo-pituitary adrenal axis. It's one of the major side effects.
Metabolic
syndromes.
syndrome. What? Constituents: hyperglycemia, hypertension, dyslipidemia. Sit down. Good. So cyclophosphamide, it was used twice in this child before attaining maybe 10, 12 years of age. So cyclophosphamide, again, any other pharmacoresident? What are the major side effects? Not to be used in children. Yeah. Another one. Sit down. Sir.
Cyclophosphamide can cause hemorrhagic cystitis, sir.
Yes. That is something acute.
Yes, sir.
What about in long
Some
term?
dermatological manifestations also.
Yes.
Pulmonary fibrosis.
We are more concerned about something else. Young. Can you answer your colleague?
Sir, it mainly causes hemorrhagic cystitis and
No, don't
pulmonary
repeat what he said. So it is gonadotoxic. Have you heard of that?
Yes.
And causes cytopenia also. Sit down, please. So, Robin, what is the gonadotoxic dose?
So 300
Cumulative.
So 300 mg per kg, sir.
300 mg per kg,
Yes, sir.
in an adult.
Yes.
And you should restrict it to less than 10 for those who are willing to conceive in future, less than 10 gram over lifetime.
Yes.
And if it is more than, what is the dose which has malignant potential?
Sir, 36, sir.
Very good, 36. Okay. And more than 80 can
Myelofibrosis.
Myelofibrosis. Sit down. Chandrasekhar, when do you start anticoagulation? We started in her.
Sir, hypoalbuminemia, sir, less than 2 to 2.5, sir.
Yes.
And proteinuria, sir, more than 10 grams per 24 hours.
Yes. Anything else?
And obesity, BMI more than 35.
You read the slides. Sit down. So now my question is, okay, you have started 2 and stand up again, 2 and 2.5. Okay. So when will you start, at 2 or 2.5?
Less than 2.5.
So anyone who has these BMI and all, someone is pregnant, so less than 2.5. And for everyone,
to less than 2.0.
For everyone, if it is less than 2. Okay. So when will you stop it? Anticoagulation. Lifelong. When do you stop?
If remission.
Yes, remission. What will you monitor? Proteinuria.
Proteinuria.
No, it's serum albumin. When it normalizes, you stop, or rather it reaches 3, then you stop. Out of those primary GNs, which has the most potential for thrombosis? MCD, FSGS, membranous. Okay, sit down. And when to consider statin therapy? Next, Ashok.
Sir, firstly, we wait for 3 to 6 months for the control the disease, sir. If there is LDL is more than 100 milligram per deciliter, then we start statin therapy.
So how long you wait?
Then, sir, around 4 to 6 weeks, sir. 4 to 6 weeks.
So
okay. Again,
ideally, if it is an adult, you can calculate ASCVD score. Okay.
Sir.
So if it is high, then you can start upfront. Otherwise, you wait for 3 to 6 months.
Sir.
It will resolve spontaneously. It may respond. Sit down. So we have given Septron. Abhishek, you answer. When to give?
When an individual has been on steroids of more than 20 milligram, at least for a duration is 30 days.
Yes.
Then we have
when you are planning to give it any steroid for more than
30
days,
days,
20, 15 to 30 high dose prednisolone. That is.
Yes, sir.
How long will you give?
Sir, we give until the patient has been at a same dose, sir. If more than 20 milligram has been persistently being given, the patient can be on lifelong Septran as well. And once the steroids have been tapered off below less than 20 milligram, then we can
So
take a
again, it is not clear. Some mention it 10 or some mention it when you are tapering it. We started in this patient at 60. So when we'll start tapering and her dose is to 10 or 15 milligram per day, we can stop. And this is to prevent